morning.
Good morning.
Welcome to the AIA California Healthcare Facilities Forum 2020.
Woo-hoo.
Thank you for joining us. I am Meredith Sherbo. This, with the sunglasses, is Scott Mackey, and we are co-chairs of this event. 6 months ago, who would have thought that virtual conferences would be the norm? As with so many other changes in the industry and in our lives and in healthcare in general, this forum has always had a focus on the future. Trends, technologies, so many things that have impacted healthcare delivery and the design and construction of healthcare facilities. So let's hear what our speakers and panelists have to say about their past 6 months and their experiences and their thoughts about the future, and more importantly, about the opportunities that lie ahead in a post-pandemic world. Scott.
Hey, welcome. Broadcasting live from Tangram Interiors Studios in downtown Santa Fe Springs. Welcome, everyone. Glad you could join us. The agenda, let's go through that. 3-day event starting today and then the next 2 mornings, obviously. Now, if you can't attend all 3 days, don't worry. Conference is being recorded. Everybody will have access to the recording up to the end of the year. At that point, we're just going to cut it off. But definitely take advantage of that opportunity and even review those later on if some things come to mind. So overall focus this year is the impact of healthcare delivery, revenues, capital program, and the challenges associated with post-COVID patient care. Each day we'll start with a keynote speaker. Then we're going to have a breakout session. I'll get into the breakout session in a minute. And then we're going to have a panel of experts talking on various subjects. Day 1 speaker will be Mark Gamble, Chief of Advocacy and Operations of the Hospital Association of Southern California. He's speaking globally for the healthcare members of a hospital association, this one in Southern California, obviously. Mark brings the insights as to the challenges they have faced during 2020 and the outlook for healthcare in 2021 and beyond. Day 2 speaker is David Johnson. David's the fearless leader of Foresight Healthcare, a company addressing the importance of personalization in healthcare. He's recently written a book on the subject, The Customer Revolution in Healthcare. You'll be notified after the conference as to the winners. He has recently written a book, right? And we will be we're going to raffle off several of his books after the event or during the event, and you'll be notified afterwards as to if you're a winner or not. And we'll be shipping those books directly to you when we communicate with you. All right, we're past day 2. It's on day 3 here. Backed by popular demand is Ron Galloway, a futurist speaking on the changes and disruptors in the healthcare industry. If you haven't heard Ron speak before, you're in for a treat. He'll inform you and entertain you. Ron is crack up. He's a great guy. I enjoy talking with him all the time. Each session will have the opportunity for questions and answers. They are meant to be interactive, but due to the difficulties of interruptions and speaking over others, we'd ask that you enter your questions in the Q&A sections. The moderator or Meredith and I will be reviewing those questions and will present those questions at opportune times during the presentations or following the presentation, depending upon the speaker. As I mentioned earlier, our program will also include breakout sessions where you can connect directly with other attendees, are able to compare notes on the keynote speaker's topics, and exchange information with friends. In order to access the breakout rooms, please exit the webinar and click on the meeting link in your chat tab. If you have issues, refer to the top of the chat list for tech support, okay? It's pretty simple. We're just gonna switch over from the webinar into our breakout session. There's a link right in that chat tab for you to do that. Additionally, today's agenda will include our annual Lifetime Achievement Award, awarded to a licensed architect whose career has been instrumental in elevating the design and delivery of patient care services through design and development of healthcare facilities. And this year we have an especially poignant award to a very good friend of all of ours. And we'll get into that later today. Tomorrow's agenda will include our annual scholarship award, which has helped so many students through their architectural education. Thank you all for your support of this scholarship program. When you registered, there was an opportunity to be able to donate, but we also thank our sponsors who have been significant in contributing the money for these scholarships. And this is something that we've really been passionate about, is extending that opportunity to students to study specifically the healthcare design solutions within their education program. And on Friday, we'll include a virtual tour of Tangram's healthcare showroom, which we're currently broadcasting from, featuring Steelcase healthcare products. Meredith?
So, speaking of Tangram and Steelcase, we would like to acknowledge our sponsors and, of course, Tangram and Steelcase, who once again have provided us with a venue for this conference and also have provided us with technical support so that you can actually see us. Again, we urge you to participate in their virtual tour on Friday. And then, of course, we would like to acknowledge all of our gold and silver sponsors. Without our sponsors, this conference could not take place. So thank you. We urge you to visit our sponsors' listings on our conference app, where you can learn more about them at the end of each day. And there's lots of good information there, everyone. Some educational information and certainly information about the services that they provide. And I also want to thank the team that is behind us, the AIA California team, and also the team from Tangram. Special thanks to Amy Orr, Hillary Crack, and Katie Dell. We couldn't do this without you. So without further ado, I would like to introduce Chris Morris, National Healthcare Director of Swinnerton Builders. Swinnerton Builders is a longtime gold sponsor of this conference. And Chris is going to introduce our opening speaker. So take it away, Chris.
Thank you, Meredith. Good morning. We are very proud to introduce today's keynote speaker, Mark Gamble, who is the Chief of Advocacy Operations for the Hospital Association of Southern California. Today, Mark will be providing a big picture overview of what is keeping our hospital leaders up at night and what we might expect in 2020 or 2021. Welcome, Mark.
Thank you very much, Chris, and appreciate the introduction. And thank you, Meredith and Scott, for inviting me back as I'm trying to figure out share screen. Here we go. Okay. It's a surreal setting to be here with you today, looking out at my front yard. But I know Craig Beam is out there someplace sitting to my right. And Craig, we're not going to be able to have our usual banter back and forth. I'm sorry about that, but I do appreciate the invite back. So what's ahead for 2021? I feel like saying, let's just get through 2020 first and then worry about 2021. But we've got to look at how we are going to get to it, where Meredith said, the opportunities post-pandemic. And a lot of the time through this pandemic, I've been thinking about my grandmother, Granny. She was born in England in 1900. She lost a father very early on. She survived World War I. World War II, she was immigrated over here to the U.S. With a suitcase and 2 young children. She survived the pandemic, obviously, and many other challenges. So that generation, I've told our kids, survived much more than what you guys are going through. But I did tell our 2 teenage kids that you are going to be much stronger as adults having come through this. So it's quite a time in the history of the world. And so here we are going through it together. And now I'm going to try and let's get my screen to move. It worked this morning when we were practicing. You all can, there it is. All right. So what I wanted to give you is some sort of a taste for where we have been the past couple of years when I've been at Steelcase to present to all of you. It's a view of downtown. I haven't been downtown in 7 months. As many of you have, the world has changed. So who is HASC? Who do we represent? We have over 180 members in Southern California being Santa Barbara, Ventura, LA, San Bernardino, Riverside County. And for those of you from San Diego or who know San Diego, they think of anything north of Camp Pendleton as being LA, and they are not Southern California, they are Southern California. So there's an association down there. So we thought we'd start today with a poll question, kind of an icebreaker, since we couldn't gather for coffee and breakfast this morning. So please pick the answer that reflects what your current point of view is. Really, you've now decided you really don't need all that office space. You never knew you could live without sports. And now you can't survive without Instacart, Grubhub, and Postmates. You love your kids, but school should reopen immediately. Or lastly, wouldn't be surprised if California was hit by a swarm of locusts, tsunami, and an asteroid before the end of 2020. So please make your selection, and then we'll see which one you all feel reflects your current point of view.
You can't vote.
Yeah, unfortunately, the hosts and panelists cannot vote.
Thanks, Mark.
Sorry.
Appreciate that.
Darn it.
You know where we were going to go with it anyways.
All right, so are we waiting on the results here? There we go. Okay. So it's the commercial real estate folks, I'm just feeling very sorry for them. As obviously, we wouldn't be surprised what happens in the rest of 2020. That is certainly the case for those of us who felt the earthquake a couple weeks ago. We've certainly the fires. My view from where I'm sitting right now is of the San Gabriel Mountains and plenty of smoke over a very long period of time. All right, so let's go.
Mark, I just want to let you know that Craig Beam says, can we select all of them?
Yeah, that's why I've had all those thoughts.
That's right.
In my mind at some point. All right, so this time last year, I was standing before this group, and we went through what we see as our 2020, or what we saw then as our 2020 public policy priorities. So just to recap, behavioral health, that was number one. I shared with you it is the number one policy priority for all 4 hospital associations in California as it's become a big crisis. Reimbursement, especially when it comes to Medi-Cal, Medicare, those are always on top of the list. Government regulations, we're always dealing with those. Quality and patient safety, that was something and remains at the forefront, but that was top in 2020. Access to care. So those were the things we really talked about. But whoops, you know what? I realized after I left that conference, I forgot to include the global pandemic that was forthcoming. So I don't know, I didn't have a chance to make that prediction, but I thought about it as I was heading down the elevator from that conference.
Good timing.
Yeah, so boy, since then, life has changed dramatically. Instead of being downtown with all of you, a view of the skyline there, I'm instead sitting within 10 feet of my daughter's 12th grade, what is she? She's a freshman. Her classroom's down the hall. Across from her is my son's junior year classroom. And then down the stairs here, because I get relegated to a makeshift desk at the top of our stairs, my wife is at her desk in our den.
They must be on their...
Yeah, that's why I have the background, because you could see the kids walking through the through my office here. So this has been my favorite shirt to wear. This is something I picked up early on when we were in a motorhome trip. We were supposed to be in Italy for my daughter's graduation, but instead we took them on a 24-day motorhome trip. They don't go anywhere near the motorhome anymore. So we continued to have the legislature meet. It was somewhat surreal, according to our lobbyists up at CHA. Most of it was done remotely. And of course, we did have our share of bills to fend off. I'm going to highlight a few of them. The first one, this would have been devastating to hospital systems, hospitals and health systems in California. The Attorney General wanted to get be granted the authority to approve just about any affiliation agreement, partnership, joint venture, or other arrangement that a hospital or health system made with any of the facilities that they interact with. That would have created a huge regulatory and oversight barrier and burden on hospitals. So fortunately, that failed passage. And then, of course, the pandemic led to several pieces of legislation, or more than several. And it's interesting, there were two dueling pieces of legislation regarding PPE, personal protective equipment. I think you all heard early on that there was a devastating shortage of PPE. We saw that the just-in-time supply chain that had worked so well and helped hospitals reduce costs fell apart, especially with its reliance on a lot of its raw material and actually manufactured goods coming from countries that were hit very hard by the pandemic and then decided to keep PPE for their own use. And so now there are two pieces of legislation that the governor signed that require hospitals to maintain a stockpile of PPE. We were able to water those down over the legislative session, and we're going to be working with hospitals and the state in terms of how best to implement that. And then this one also, as a result of the pandemic, it is now, there's rebutable presumption that COVID-19 infections are work-related for those critical infrastructure people that you see, police, fire, and healthcare employees. And it's going to be workers' comp, a big workers' comp issue there. But it is rebutable. Previously, it was assumed that it was caught in the workplace. And then this is something that would be interesting to all of you. What's going to happen with seismic as we head to the 2030 deadline of the seismic legislation? We tried to get it extended for 5 years. And then through the process, it was shortened to a 2-year extension. And that was not significant enough for us. So we asked the author to hold the legislation. So we are going to take another crack at that next year. And we've got to get that extension because of all the factors we'll talk about in a little bit, having to meet that requirement. Last year, I think I talked about the RAND study that talked about the billions of dollars that meeting that requirement are going to cost the healthcare delivery system, especially the hospitals, I should say. All right, well, what's the impact of COVID been on hospitals? It has not been pleasant. It has been very, very challenging, as it has for so many other businesses and individuals throughout the world. But what happened is that early on, when we saw what was going on in China and Washington State and New York and Italy, we started to prepare for that. And we being really led by public health and Governor Newsom and the local public health authorities in the counties. And so they asked hospitals to make room for a surge of COVID positive patients. And they did that. So they sent everybody they could home and they stopped doing non-emergent procedures. That created a significant shortfall for hospitals to the tune of $14.6 billion projected through the rest of this year. There have been 2 or 3 relief packages provided to hospitals for the costs incurred, and that has totaled about $5.6 billion. But that it was not applied consistently, and there's some hospitals that received very little financial support. And it has been very, very difficult times for hospitals, and we're not seeing the non-emergent cases return to a normal setting yet. And then sadly, there are a number of people who went without health care that they should have received, and they've had bad outcomes as a result. So Meredith asked me to predict what was going to come the remainder of this year and in 2021 and beyond. But sadly, the fog is thick in my crystal ball. I did say to Scott and Chris and Meredith earlier in the week that, now's the great time to make predictions, because this whole thing could go any direction. And my predictions, who's going to remember them by this time next year? Who knows where we're going to be this time next year? So let's try anyways. But
we're still holding you accountable for the pandemic that you didn't tell us about last year. So.
Thank you. Thanks, Scott. All right, so we've got a couple of we got a lot of unknowns. Herd immunity. When are we going to get that? Now we know the term herd immunity. When is it going to be enough for us to take off our masks and go back to 100,000 people in the Rose Bowl watching the New Year's Day game? I referenced an article that was in Politico a couple of weeks ago. I highly recommend you read that article. It's lengthy, but it talks about the 11 epidemiologists who they interviewed, and they were somewhat all over the place, but the consensus is that sadly we aren't going to get anywhere near normal until at least November 2021, meaning we're probably going to get a vaccine sometime early in 2021. But what's happened in the past is we've developed vaccines. The efficacy rate of them is not that great, and they're hoping for a 50-50, one that works 50% of the time. They say even that will help create herd immunity. The other thing we don't know is how long will immunity last. I think we've all seen in the paper recently or in the news about that individual in New Mexico who was confirmed a second case of COVID. And so there's a lot of unknowns around when we develop herd immunity. But once a vaccine comes out, that does not mean we can go without masks and the social distancing.
So, Mark, we also put a link to that article in the chat section. So anybody wants to check that out, just go to your chat section and find the link there.
Great, thank you.
But you might want to have a drink first.
Yeah, yes, you should do that. And I did tell Scott and Meredith that, you know what, I've always enjoyed presenting to this group because of the interaction we can have during the presentation. And I was somewhat worried about how this might work without being able to be interrupted by Craig Beam and others. So if any of you do feel like interrupting, I guess you can. Craig, you've got my cell phone number. Send me a text. Here's another unknown. What's going to happen in November and possibly beyond in terms of the election? And what are the consequences of it going to be? Let's hope for everything stays calm, cool, collected heads and cooler heads prevail. But we could see a prolonged out before we know the election outcome. And what the impact does that have on all of us in the situation? And then the Supreme Court ruling on ACA, on the Affordable Care Act, sorry. We will wait and see what happens with that, but that could be devastating for states like California that did do a great job expanding Medi-Cal eligibility. And I think probably my first couple of slide decks, if you go back to when I first came here 3 or 4 or 5 years ago, we talked about the high rate of uninsured, and then the ACA passed, and we've seen that drop significantly with the expansion of Medi-Cal. And now this is going to be the reality too, is the federal and state governments have poured billions and billions, unprecedented amounts of money into the response to COVID-19 and the pandemic. And at some point in time, those deficits are going to become extremely burdensome and are going to have to be paid, at least portions of them back. And so they're going to have to make cuts. And usually the first to get cut is healthcare. And so we will have threats to Medicaid and Medicare that we will have to deal with over the foreseeable future, going out well beyond 2025. And then what else awaits us in 2020? We'll just have to see. We do know that other parts of the country are starting or are in the middle of surges. And so we know that we're going to continue to see waves and surges in various areas. It's interesting because the first surge in California, particularly in Southern California, came after kind of some other parts of the country and the world were coming out of their surges. So we seem to be lagging, and I'm not sure what is driving that. And we're also seeing that the waves happen in Southern California in pockets. When the COVID-19 first hit, Glendale and some parts of Pasadena, where I am, were hit really hard, and other areas were not. And then with the second surge we saw after Memorial Day, San Gabriel Valley and other parts of California, Southern California, like down towards San Diego and Riverside, Imperial County, were hit extremely hard. So it's not a clear-cut spread, and the waves are not consistent, but they are going to keep coming until we do reach that point of herd immunity. So with all of that going on, how do we set our 2021 public policy priorities? So obviously, COVID-19 is at the top of the list. But sadly, there's the fallout from COVID-19, and there's everything else that was happening in healthcare prior to the pandemic that we've put on the back burner that we're going to have to also address. So CNN did an article the other day about the second wave, and that being the impact of COVID-19 on the mental and behavioral health and substance use. And so I titled it Second Tsunami because it's more than just a wave. We were already in a crisis mode, and we've talked about that last year around mental and behavioral health and substance use. We are going to see that continue to increase. We've had weekly or monthly calls with hospital discharge planners, case managers, and social workers. We originally set it up to deal with a piece of legislation that was implemented earlier in the year around providing services to homeless individuals. And we've now expanded that to talk about the impact of COVID-19. Sadly, the children's hospitals are seeing a number of individuals, young kids, come in with suicidal ideations and attempted suicide. We're seeing an increase in substance use disorder throughout the adult population and also adolescents. And COVID has created an additional burden on people's lives that are leading to complications in mental and behavioral health. And that same can be said about the complications of the healthcare workforce. They are strained to a point of that I've never seen. During the surge after Memorial Day, we had weekly calls, and we still continue to have weekly calls. But when we were having those weekly calls with CEOs in our counties, I heard a strain in their voice that I have never heard in the 26 years that I've been with HASC. And a number of them who've been around that long or a little longer have said this is unprecedented in terms of what they've had to go through. They've had to deal with disasters and emergency responses, and we've had isolated incidences where there's been a lot of stress on the system, but this has been had a broad impact, obviously. And so the frontline caregivers are strained and stressed, and they've seen I think some of their biggest frustrations come from seeing what they see every day in their ICUs, and then hearing those of us on the outside talk about this being either a farce or this being a political issue, and the fact that we don't need to wear masks and all that. And I think it adds additional toll onto the healthcare workforce. So we're going to have to deal with them, and we have put together some initiatives to help them cope with what they've been dealing with on a daily basis. And obviously, the revenue impact, and this really, I think, will have an impact on all of you in terms of as hospitals look to how they spend going forward and what their ability to spend. You all will have to consider that. And also, what does it mean to construction, and what is the best type of hospital and hospital room to build going forward? And then we've talked about reimbursement, and that continues to be a challenge. And I just see a text from Craig. He's going to leave me alone this time. Scott, you going to take any bets on that?
No, I'm not touching that.
Yeah, Meredith, you know Craig better.
Yeah.
And then we're going to have a wave of government regulations coming through this. You know, what's been interesting to watch is that public health, the state has always granted, or through, I don't think it's the Constitution, but long ago they granted public health authority to the counties, and then in California, in Southern California, 2 cities, Pasadena and Long Beach. And so that has led to really a disjointed response, an inconsistent response from county to county. So it'd be interesting to see what the state might try and do to bring oversight for public health to a statewide or to a state level, and then how that interacts with the federal government. I think that's been one of the biggest disappointments that I've seen through this, is how poorly we've been able to coordinate, both from a testing and contract tracing, and also the supply chain. Those are really, for me, 3 of the biggest disappointments. And then this also, you're going to have some, I think, increased mergers and acquisitions activity come up in 2021. We started to see it in 2020. It slowed down to a degree here as we've all had to put things on hold and pause for a while as we've dealt with COVID-19.
Doesn't that have to do with revenue struggles as well? I mean, some entities that are struggling are looking to be acquired by others.
Yes.
With greater financial strength.
That is very much the case, and I think there are some systems that they're all facing some significant financial challenges based on that revenue shortfall and the cliff that hit them when the revenue just stopped. And then we talked about social determinants of health last year, but really racial inequities became front and center earlier this year. And we will, and it's really now on the radar of our hospitals, and we'll be taking on several new initiatives related to racial inequities and social determinants of health, and the impact that those have had on COVID-19, and in terms of who gets COVID-19 as well. So we've talked about behavioral health. This is really, this is for all of us. I say this both personally and from a healthcare perspective. Please, please, please take care of yourselves and your families as we go through this. We all have, I guess, our various ways of coping, some healthy, some not so healthy. I will say this is the first time I put on a pair of slacks in 7 months. I was happy to get
We were wondering if there was anything under there, Mark.
Yeah, well, there is a pair of slacks on. You know, it's tempting, but from here I have to go to my kid's school for a socially distanced and masked event with just a few people. So
it wasn't just for us. Thanks.
No, it wasn't just for you, but I did put on the sport coat for you.
Thank you.
And I haven't tried to button it, but yeah. So we just have to be aware and conscientious of how we take care of ourselves. And I've seen it on the teenage kids. It's a strain for them, and it's a strain that they're going to have to learn to adjust to. And so we just need to make sure they have the right resources to make sure they have the coping mechanisms in place. So would like to open it up for discussion or questions in the chat, or however we want to do this, Meredith and Scott, whatever you think most effective.
Questions and answers tab is the best location for those.
If you have questions and answers, or if you have questions,
Or answers.
Answers.
Yeah,
Please go to the question and answer
Mark
tab.
doesn't know.
Right. If Mark doesn't know, somebody else may. We're waiting. We think Craig may join in just to refute so much of what you've said.
Yeah.
So this is Craig joining. Nothing to refute, but Mark, I know that the CHA has started a new seismic workforce. Have you been involved in that at all, or any? I know that they just had their first meeting, so it may be premature to comment on where you think that might be headed.
No, I have not been involved, but I do know that the direction is looking at, as we talked about last year, does it really make sense to build the hospital that was around the same type of hospital that was around 10, 15 years ago and beyond? But now, where do we go with that question? What's the answer based on the pandemic? So, I have not had the conversation with the staff up at CHA, Craig. And if you're on that, are you involved with that at all? Or
Bill Eveloff from our office is involved, and I know that there's Aaron KPFF. He may be. I think he actually sat in. I'm not sure if he's on this, but he may be able to add something from chat about that first meeting. So,
yeah. So really, for the construction, any kind of construction, it's going to be, I think, the hospitals that have been hit hard on the revenue side that don't have the capital are going to be challenged. And so for all of you, that's a concern. And then also what happens more on the outpatient side, and as we move away from as we can, from keeping people out of the hospital again, that continues to be a reoccurring theme.
So, got a great question here, and Craig, you can help with this as well. What are some of the indicators that hospitals will look for in 2021 and fourth quarter of 2020 as deciding factors for whether or not to proceed with their planned capital improvements?
Mark, do you want to go first? You want
I would say, when do we return to that normal, somewhat normal baseline of the non-emergent procedures? And what's the outlook for them individually on a financial strength basis? The financial markets, though, I mean, the interest rates are at a point, but are they going to make loans to hospitals that are strapped? Craig, what do you think?
Yeah, well, so I think most of the big systems are either in freezes or slowdowns on their CapEx spend, and the cash drain has been pretty significant. And I think Mark's spot on. It's really the return of, I got chewed out for using elective scheduled procedures. So nobody really elects to have surgery done, or rarely elects to have surgery done on themselves. But the most of the folks that we're talking to, they're at 80 to 90% of normal. But if we get another surge, I think we're going to go back down, and people are afraid. And you touched on this too, Mark, earlier, is the stuff that's not being done. We have no idea what the longer term consequences of the lack of the prophylactic procedures that are not taking place now, cancer treatments and other things that have been postponed. So we already see a much higher background death rate, not just from COVID, but from all causes, than what would be expected. I think CapEx is going to slowly start coming back. Maybe capital expenditures will start coming back maybe second quarter next year, but that's presuming a light fall and winter resurgence.
Right.
Well, then you got to take into account the flu season also that's coming up, because that's no longer elective or selective. It's again a need, but now you've combined two different things into the same situation, and I think that kind of goes along with the next question. What changes are you seeing in planning and design responding to the emerging research about COVID? And I'm going to tack on, the flu season that's upcoming as well.
Yeah, I think it's going to be more isolation rooms, more negative pressure, more ICU, in ways to keep the virus from spreading through HVAC and other the aerosols. Mm-hmm. Craig, anything you think different?
No, I completely agree. And, ironically, in the old days, that's how a lot of the HVAC systems were designed, is you could convert them. And just with inventory, as we became more efficient in our design, we decided not to spend money that way. So, and then the other thing is hospitals looking for how they can adapt for surge capacity, which is converting rooms into essentially makeshift ICU rooms. The part that I don't know that's been fully addressed is the entire workflow. So how do you have, because it isn't just the frontline personnel, it's housekeeping, it's others, and how do you manage that workflow without further creating a transmission of the disease? So, and my next panel, which is coming up, will have some frontline people be able to more specifically address that too.
Mark, I have a question for you. When we spoke in April, I believe you predicted that there'd also be an increase in pregnancy rates. And I know it's a little early, but I'm wondering if that's still true, or if the divorces that are undoubtedly increasing, if that sort of killed that one.
Yeah, I think it's a wash, Meredith.
Okay. Okay.
My wife and I were talking a couple of weeks ago. She knows somebody who was just married, and they are now separated because they couldn't handle spending so much time together.
Tough way to start a relationship, that's for sure.
Yeah.
All right, next question. How will the AHA and CHA view recommendations of other professional organizations in regard to building safety for pandemics, i.e. ASHRAE?
Well, I think that, and again, I'm not familiar with or not involved with the task force Craig mentioned, but there are outside entities in there, and I would hope ASHRAE is involved with that. So we do listen to the experts. We don't always do what the experts say to do, but we do listen.
So, Mark, who will bear the cost of behavioral health? County, the state, private? Where do you see the money getting spent for? I mean, we talk about the tsunami effect of this care model, but I mean, where's the money coming from to pay for it?
Well, that's the thing. The money is so disjointed, and the revenue, or who is responsible for paying for what in mental health. We talk about parity. There are, I think mentioned this last year. There are some forms of mental and behavioral health that the county DMH, Department of Mental Health, is responsible for.
Right.
And then there are some where the local Medi-Cal managed care plan or Medi-Cal plans are responsible for. And you could have one individual who bounces back and forth between those two entities. Right. And they've got to navigate a very complex eligibility system. And when you're in a behavioral and mental health crisis, or even just diagnosis, you aren't in a position to be able to navigate that effectively. It's difficult for me to even figure out, if I was this, then I would go here for coverage. And if I had this, I would then bounce back to this other resource. And then the substance use is something else altogether. So it's a disjointed system. And that's something that we are going to have in our priorities for 2021, is how do we make it more seamless for individuals? And I think our biggest concern for all our members right now are the number of people who come in on involuntary holds, which are called 5150 holds, brought in either by law enforcement, fire, or family members. And they are brought to hospitals that don't have a behavioral health service. And these individuals sit in emergency departments and 5150 means you're a threat to yourself or others, and it's a very bad situation, and it does nothing to treat the individual's condition that put him on her on a 5150 hold.
Right.
And so go ahead, Craig.
Well, so Orange County is starting a new initiative called Be Well, which I would encourage everybody, which is really a cooperation between all the agencies, including HASC was one of the initiators of that, and the member agencies. And, I think we're all anxious. Rick Afabli is really leading that here in Orange County. We're all hopeful that it's going to work out. The other model in California is Alameda County, which has set up an emergency, sort of a freestanding behavioral emergency, and it's all county coordinated. It's more focused on the pure 5150s and getting those out of the hospital system and freeing up those spaces. Mark, you may want to comment. One of the sister organizations to HASC is the National Health Foundation, and some of the housing initiatives they've taken for both the homeless, which is clearly intertwined with the behavioral health issues.
Yep, and so National Health Foundation has a recuperative care program, and they are looking to expand that into additional housing. They've been challenged because of COVID-19 in terms of being able to have individuals share a room, but they have a model that really looks at getting people stabilized into a point where they can get into permanent supportive housing. And so we need to address the crisis from multiple angles, but we need to do it in a coordinated and more of a strategic way than I think has been done. I've been saying there's Anthony Abate, who was with CASC. I knew Craig would know who that was. He was talking about a behavioral health crisis when I first started 26 years ago. And so sadly, it has done nothing but deteriorate. And I think it's because we don't have a focused approach on it at the county level. And that is one of our priority areas, is to work with the counties, boards of supervisors, Department of Mental Health, EMS, and Department of Health Services to put in a coordinated approach to dealing with it. And I should say the Medi-Cal managed care plans too.
So I'm going to ask, this is a question from Ron Radina, Mark, is what do you foresee as additional CARE Act-like passage either before or after the election? And is that, and if anybody saw Nancy Pelosi on CNN last night, that tells you how sensitive the topic is. So, yeah,
if we see anything, it'll be, I think, a token. And then after the election, I think, is when the significant movement happens. But that all depends on and that goes back to my slide of so many unknowns, the election and the consequences, what happens with the Senate, what happens with the presidential outcome. But I do think there will be additional CARES Act coming. And I can't see them not putting more money into it. If there's interest to do it now, it's stuck in an election year.
Yeah. Yeah.
We have a question also coming through the chat room, which is, will healthcare systems be able to continue virtual health to the same extent as they are now through reimbursables? Yeah,
that's been interesting. So we saw telehealth, which we've been talking about as being an important piece here of the future of healthcare delivery. And so there were allowances made, but I've heard some, as it's been implemented, hasn't continued to be as effective as we thought it would be. On the other hand, though, I do think there will be reimbursement and regulatory relief from any regulations that restrict the use of telehealth and telebehavioral health. So I think that one of the opportunities you talked about, Meredith, in terms of the post-pandemic will be a broader adoption and reimbursement for telehealth services, which I think will need to be factored into the future construction plans.
I think it's pretty clear that obviously the COVID impact has made a huge differentiator to telehealth. And so reality of that service and its equity of care has been recognized. And yes, the means with which to reimburse the physicians and staff for those opportunities should be considered and resolved, and a solution moving forward.
And I want to tell our audience that is certainly going to be part of the conversations that we have with our panelists and also our speakers, and particularly on our last day. We're going to have actually some of the creators of some of the telehealth platforms that are out there. So we urge you to stick around so you can hear that.
So there's a couple of questions that are asking about predictions for facilities and what their needs are. Upgrades, large-scale facilities, small-scale facilities. What is the thought right now in terms of the future projection? We just talked about telehealth and what impact it's going to have. And is that a reduction in medical office space? Is that different facilities with different needs? And then on top of that, what about the facilities that need to grow and expand but don't have the financial capacity to do it because of the result of the pandemic revenue reductions?
Yeah, so I think the medical office space, I don't think that's, what we're seeing here is that a number of us who've been working from home really miss our office. And I don't miss.
Come on, you don't want to wear pants every day.
Yeah, I might not go back to the office 5 days a week from 8 to 5, and I think that same could be said for physicians. That you can do the tele, but you're still going to have to see patients in person once you get through the tele part of it. People are going to need to have that care.
Or even the initial visit being in person and follow-up being tele.
Yep.
Right?
Yep. There are certain things that are done in the physician's office that can't be done electronically or via telehealth. And so I don't see it as much of a threat. There might be a reduction. And remember, we also have a population that we're going through the baby boom here. And once we get past the baby boom generation, we have a smaller population. So there are fewer of us just on the outskirts of that baby boom, the end of the baby boom line, that we won't need as much capacity. Craig, you want to follow that up as the baby boomer?
As a baby boomer? No, I would add, though, that the commercial payers are already trying to backslide on the reimbursement, and been involved with some of the big healthcare public nonprofit agencies to try and make sure that doesn't happen. Frankly, their concern is when there's greater access, there's greater use of that access, so it ends up costing more money, even though it may be more efficient use. As long as CMS keeps it in their reimbursement model, it's going to be hard for the commercial payers to backslide on the topic.
Yeah, and then for the question about what do the facilities do that don't have the capital, I think we're just going to see it. They won't be able to. I don't think there will be any entity, state or federal, who comes in with a
bailout
to bail them out, because I think the CARES Act and all the money that the feds and state have put into the COVID response, it's going to be hard for them to tackle new.
Does that apply to seismic upgrade and compliance as well?
I don't see. That's the thing. That's why I am hopeful they will get an extension, because we've got to have the hospitals that can't afford it. They got to get money from someplace. So it's either going to have to be from the commercial markets, or the government's going to have to step up, or if you stick to the mandate, then hospitals are going to close. And we've seen through this surge, or these surges, that we don't have capacity to handle a surge. So you don't want to take more hospital beds offline at this point in time.
Right. They got to generate that revenue independently, or they've got to get it from someplace else, a government entity or other sources.
So that brings us to another question, which is, what are the next steps specifically on revisiting SB 1953 deadline movement past 2030? We know you've talked about some new legislation that is coming out. Can you be a little more specific, timing-wise, and specifics about it?
Well, it'll come back when the legislature reconvenes and the next session starts, and there will be that same debate about pushing the deadline out. But I don't have any more specifics in terms of what the game plan is as we go into this. So I apologize for that, but that's the way this is developing. Is CHA is formulating that strategy and what the best approach is. And as Craig mentioned, there's that statewide group that's looking at how to do that most effectively.
So, Mark, in your discussions with CEOs, what are some of the big, bold, pie-in-the-sky healthcare ideas that are being realized in the near future as a result of our experience with COVID?
The conversations I've had with CEOs have been more so in the moment than they have been looking out into the future.
Because of the stress and issue of dealing with it right now, and what are we going to do, right?
Not having PPEs, being mandated to test employees when you can't get the tests, the supplies needed to conduct the tests. And if you get the supplies or you get tests done, you're not getting the results back in a timely manner. So this is a point in time where we've had more discussions about the current situation than we have been forward-looking, and that's strange for the CEOs, because the CEOs typically are forward-looking.
Right.
They're operation folks, but they've had to really. It's been all hands on deck in terms of responding to COVID and getting through this initial surge and any subsequent surge we have coming out of this. But I do think some of those opportunities that Meredith talked about are going to come out in, I think I hope if those of us in California can continue to wear masks and social distance, we don't see the surge that so many other parts of the country are seeing, then we have an opportunity here to catch our breath and to say, okay, where do we go with this? And what is the best way to get through to that point where we do have that herd immunity? And what are those steps taken? We're going to meet with our board in November to have that conversation, barring any surge between now and then.
Sure. Craig, have you heard anything?
Not really. So I don't really have anything to add.
No, that's fine. It was interesting. Kaiser Permanente in their event last week was talking about their revisioning of medical office building due to the impact of telehealth and how much of their service is going to be reoriented, in a virtual basis. And I think that's telling. And I think a lot of facilities are trying to look at, what's the impact, what's the outcome of all that we've dealt with for the last 7 months. And obviously, Mark, we're going to hold you to any predictions that you have anyways, because you did such a good job, alerting us to this pandemic for this year, that they don't know what's happening either. But as Mark just said, CEOs, that's their job, that's their somewhat obligation in some ways to look ahead and make those adjustments, make those broad-reaching attempts to say, how are we going to deal with healthcare delivery down the road, and what's it going to look like for our patients?
Yeah, and coming up in the next panel, Scott, we have Bill Caswell, the COO of Kaiser, so that'll be a good question to ask him. Right. Kaiser has certainly been at the front edge of alternative points of contact with their members, but also Helen McPhee from Memorial Care is starting to see some sort of contraindicating trends. So it'll be good to hear from them directly of what they're actually experiencing this. I would just say in general, things take longer than we think they should in healthcare. Like Anthony Abadi, I started working on telemedicine 20 years ago, and there was no reimbursement mechanism. So hopefully if that changes, I think there's some real potential for impact. If there's backsliding on the reimbursement, I think we go back to sort of show up. Also, I think there's generational issues. So as Mark pointed out, I'm a Medicare carrying customer now. So my generation is probably less adept, and certainly my parents are even less adept at using telemedicine as a way to interact with physicians.
Right. And that, of course, is going to be a topic on Friday, because we are looking now at chronic care and home care, particularly for the elderly, as being as coming through telemed. We have many more questions. One question is any indication about the negative and positive airflow, convertible ventilation systems from positive to negative, and when those may actually come back online, and is there an OSHPD? Is OSHPD looking at that?
That's getting a bit above my. I'm looking at Craig here. That when I pivot to Craig, you know the answer.
Well, I don't know that I know the answer. It's again, I suggest it's nascent. It's just as ironic. We're looking at UC San Diego, their Hillcrest campus, and the original tower, which is not seismically compliant, was built that way.
Yeah.
And so that's what sort of brought it back to mind. And I'm sure that there's some HVAC and MEP guys that are probably better equipped to answer that question. Maybe somebody can type an answer to that question for us.
HVAC.
Yeah.
Yeah. one thing in terms of opportunities going forward, I do think there will be more of a push for more green and environmentally friendly construction, and also buildings, and making changes to hospitals to make them more environmentally friendly as we go forward. And if anybody has an alternative to diesel backup generators, come up with that. But that's the way it is now. And we've seen with the power safety or public safety power shutoffs, the diesel generator, the backup generators do not power the entire facility. And so there's got to be I think there will be a deeper look into how do you store enough power to maintain operations when there are these public safety power shutoffs and other situations where you lose your power source. And there are competing efforts between the electric and the gas and those various discussions in terms of where it might go. But I do think that's something that you all will have as we get out of this pandemic. I think more hospitals will focus on that once they're through this situation here. So
we just had an audience member ask about the Tesla, if anybody has vetted the Tesla power sources.
Well, I have at home.
Our neighbor's doing it down the street, so I saw Tesla's roof being installed there. So
yeah, I have a power wall at home, and we live in an area where we've had power shutoffs. So I mean, your point is well taken. And most of the hospitals have a 72-hour diesel supply, and there have been times up north, especially, of where the shutoffs have extended beyond the 72 hours, and so then you get into refueling issues. There's been some very early work around hydrogen fuel cell storage, which is a much greener process. But I don't know, and again, I'd have to look to the experts. I don't know that any hospitals have installed it, but I know some manufacturers have installed fuel cells for backup.
Yeah, and I think we'll start heading down that path. I mean, we may be forced to go down that path depending on what AQMD and others do around the diesel piece.
So, Mark, another legislative question. Any discussion with the legislature to extend AB 2190's deadline due to COVID?
AB 2190's deadline. I'm not sure. Sorry. Somebody help me with what AB 2190 is.
Maybe.
I'm not familiar with it either, Mark, so don't feel bad.
Yeah. Well, I can pull out my phone, or I can yell down the hall to have my daughter look it up real quickly.
The seismic compliance.
But on that 1950, or was that one of the extension bills? Because I think
it was the extension
bill.
Yeah, I still refer.
Yeah, that one that's still open. Yeah.
Yeah. So that's what CHA tried to do this year, and was able. They had a 5-year extension they were looking to secure. But then through the legislative process, it got narrowed down to a 2-year extension. So that was not enough. And so CHA asked the author to stand down, and we'll come back to it when they return to session. Right. So that's CHA's top priority post or outside of COVID.
Sure. And like you said, it's hung up because it's an election year. So the other one is, if the current pandemic's impact isn't analogous to the Great Depression, what do you see as the chances for greatly increasing healthcare coverage for the underserved? I think this is, the discussion about ACA and, the huge advances that it did in this state. But where else do you see this being able to happen?
Okay, Meredith and Scott, if you're going to invite me back in an election year, will you hold the conference after the election? So that question is easier to answer.
I get you. Totally understand.
Yeah.
Well, it certainly wouldn't be as interesting, but okay.
No. So fingers crossed that no matter what the outcome is, and no matter what the Supreme Court rules, we don't undo Medi-Cal expansion, because the uninsured rate in California is significantly lower than it was before the Affordable Care Act. And so I do think there's some fixes that need to be made, because remember, we've talked about this in the past years, that the Affordable Care Act really didn't do anything to make healthcare more affordable. It just did things to expand coverage. And so there are some things that we do want to see happen to make it more affordable, which then would allow people who aren't eligible for Medi-Cal to access coverage through commercial markets.
Assuming it stays.
We're going to assume it stays. We're going to be hopeful.
We will find out soon.
Yeah.
Okay, so we have another one about do you project the pandemic may precipitate any changes to building codes and regulations?
Yeah, well, legislatures don't let a good crisis go to waste. So I can't see them not having some piece of legislation or pieces that try and restructure the delivery system. And it has been a challenge for hospitals to set up separate a COVID unit and a non-COVID unit. I mean, so hospitals have had to improvise and figure out how to create two separate ICUs. And so that, but talk about a cost and huge capital that would have to be expended. So I think what we need to do is get those rooms that Craig was talking about earlier, where they can be converted, and you can have, and this would require some licensing, I think changes to licensing, to make it more easy for hospitals to create a room that could be a med surge and it can be converted to an ICU. It has all the infrastructure it needs to be converted rapidly, and so you can expand it that way. So I guess I'm tainted over the years that there will be pieces of legislation. Whether or not they make sense is the next question, to try and mandate some solution that is really very difficult to implement. Craig, I don't know what you think about that.
Yeah, I haven't seen that much state flexibility yet, which is the feds have been more flexible than the state of California has been on emergency authorization uses. So, for example, on CLIA labs, they now allow remote monitoring of CLIA labs so that they could expand all testing capacity. And there have been other instances where either the FDA or CMS has granted waivers more readily than what we've seen here in the state of California. And again, once you get outside of California, there's been, not surprisingly, in Texas and other states, you see a lot more flexibility than what we get here in California.
Yeah, there are hospitals that would like to have these flexible rooms, but they just can't build them because of the Title 22.
Title 22. If you look, like Stanford was built essentially with all ICU ready rooms. They weren't all built that way. But if you look at the added cost of doing that, it's outside the capability of most providers to be able to do.
Yeah.
Here's another question, which is the trend of the California population affecting bed needs projections as it did in the past, or has the pandemic greatly shifted this thinking among healthcare providers?
I don't think so. I think it's really I do think the baby boom generation is the one that's the trend to watch in terms of the aging population needing services. But then what happens once that baby boom generation is no longer using services? We're going to have the population numbers in California drop significantly, even though we're already a younger population. So I don't think, I think the answer to that question is I don't think so. Craig, you want to?
Yeah, well, I think, again, this requires some national perspective. So California falls into the lowest quartile of beds per thousand. And that's primarily, if you go back 20 years ago, as managed care started to influence the delivery of care in California, we have a comparatively low inpatient utilization rate traditionally. So we run a little under 2 beds per 1,000 in California. If you compare that to like the greater Chicago market, they have 6 beds per 1,000 people. So that shows you the variability as you go around the country of the number of beds available to folks. And then if you look at Kaiser, they're even below sort of that. They pull the average down, and they're a significant market share in that. So so I think that is potentially one of our big challenges if we do get a second surge, is we just don't have a lot of excess capacity in the state of California when you look at other places around the country.
What about people leaving the state and our exit numbers?
Well, our numbers are still positive, so we have more being born and coming in than we do have going out, at least the last I saw.
A little bit,
yeah.
But it's still positive.
Yeah.
Yep. Well, we'll wait to see what happens after November 3rd.
Yeah.
Yeah.
Okay, we're checking here. So any other thoughts that come to mind following this discussion that we've missed? Anything what would you say are the most pertinent issues that we should look at and kind of have our ears open to over the next few months?
Well, I think it's the surges that happen in terms of just in general. Watching what happens with the surge and the capacity. And I think if you read that Politico article, you'll see that this thing isn't going away anytime soon. I made the mistake of telling my kids in probably December and January that, hey, this isn't going to be any worse than the flu season. So I get reminded of that on a regular basis. So my credibility with them is already low. So it was shot after that.
Another great prediction, Mark.
Yeah. So I think the financial impact that this is going to have, and it has had on so many individuals and so many businesses, and hospitals are a business, and it's been devastating to a number of them as well. So I think that's looking at this going forward. Until then, we get to your point of the opportunities post pandemic. We are resilient. We'll figure it out. We'll get through it. Things will look a lot different, but we will survive.
Mark, thank you so much. Oh, Craig, go ahead.
Well, I was just going to say, I had the advantage of being in a meeting with Dr. Fauci in January, and his comment was, this is going to be really bad. And I came home and I ordered a year's supply of toilet paper and told all my friends to do the same. So I had the advantage of hearing directly from an expert in January. So I didn't make Mark's mistake.
Okay, yeah. So Craig, at a separate conversation, I want to know why we had such a run on toilet paper.
I'll save that for another day.
Yeah, exactly.
I think that goes over to the behavioral health part.
Human behavior.
You want me to put up the discussion or the question going into the breakout, Meredith?
Yes.
The reflective question?
That would be great. Okay.
So in terms of as you head into your breakout sessions, and for you moderators of the breakouts, I'm sure this is going to come up, but really, what's your outlook for the rest of 2020 and through 21 and beyond? We really got to start thinking about beyond 2021, and how you think this is all going to play out with what you know. So I do appreciate the invitation again, Meredith and Scott and Craig. It's always great to have you to the right there in this time on my screen here. So,
we've been keeping score here.
Yeah. All right. Well,
yeah,
hey, Mark,
definitely.
Great to have you always as a participant in this session too. And I'm sure Scott and Meredith share that view as well.
Okay. Bye, everybody. Have a great rest of your conference.
Thank you so
Thanks,
much.
Mark. And
Thanks,
Craig,
Mark.
thank you
Craig,
for jumping in. Appreciate it.
Yeah, we'll see you in a minute. And now we're going to go to our breakout sessions. There's a link. You should all have the link accessible
In the chat.
in the chat. And this breakout session will be 40 minutes and, of course, includes any nature calls. And if you get on your cell phones, please try to remember to get off your cell phones or into your emails. Remember to get out of your emails so that you can come back and hear our panel discussion, which Craig is going to moderate. And we're going to have a really great lineup for that. And hopefully we will leave that panel discussion feeling optimistic and excited about the post-pandemic world. Okay.
So we'll see you again at 10:30, folks.